investing at least 10% of your take-home pay is just so important to break the cycle, ensure that your kids basically will not be in this sandwich generation.
Don't be afraid to ask for help. No, I'm a very proud person. I also think I can do everything.
Not be too harsh on yourselves. You are the best caregiver if you are already there.
So what are some of the needs for a lot of these caregiving families? Welcome to our first of 3 parts. We're going to be doing this event and then one more live podcast, and then we'll see you at the 2 days Financial Wellness Festival. So I think it's a crossroad for a lot of millennials, and working professionals trying to manage this whole bit about, your finances, your caretaking needs, and all that good stuff, right? So because of these dynamics, I am very excited to have curated a bunch of people in here with me. Of course, first and foremost, Miss Bertha Henson. Great to meet you in person. Yeah, actually, I got her in because of her book, right? It's amazing, right? So I was gifted her book. I read and said, oh, this is very cool. I gotta get her on the show. So yeah, today we're gonna talk a little bit about her caregiving journey and also, go on to talk a little bit about some of her thoughts about the current healthcare system. Of course, Dr. Chong, great friend of the show, for our audience that don't know you and maybe don't know your job at HCA Hospice, although you are one of the most viral podcasts already, could you introduce yourself a little bit?
I run HCA Hospice, one of the biggest home hospice in Singapore. I am also the Vice Chair of the Singapore Hospice Council. So glad to be here. Thank you.
And we are joined with Timothy, right? Our head of investments at OCBC. For our audience that don't know you, because investment is a very big term, right? So what exactly is the head of investment? What do you do?
Basically, just to set the record straight, I look after the investment product shelf for OCBC. So anything that is sold to customers, of course, we do the due diligence to ensure that we put the best products on the shelf for customers. And I also look after financial planning to just make sure that we don't miss out any products. At the end of the day, we are here to meet the needs for our clients, right? And not to product push.
So what does the Singapore Hospice Council actually do?
Predominantly, I would say, one is to make sure that all of us who are members of the council, there are 26 members, all of us are doing sort of service provision, education, as well as research. So the first mandate really is to make sure that all of us do our job well. Quality control. Second is to ensure that the rest of the society, the general public I'm talking to, continue to learn about palliative care, hospice, because we realize there are lots of misconceptions and we want to ensure that when people need the service, they can find it. And when people need help, they can come to us.
So what are some of the needs for a lot of these caregiving families? While we stay the course of this discussion, I just want to hear, some things from you. High level.
Okay. High level, initially, when you look at it, right, ultimately it's about following the rules of thumb, right? We talk about emergency savings. We talk about being insured, which I can share a story later about how I actually got into an accident 5 months ago. And of course, it's about saving at least 10% of your take-home pay, right? Because ultimately, if you are in the sandwich generation, the last thing I think we want is for our kids also to be in the same situation. So I think we need to break that cycle.
And Bertha recently is also a caregiver, right? Because that's the premise of the whole book, right?
Yes, correct.
Yeah, when Mama fell. So maybe get us off on this thing, right? Like how has it been? What's the process of being a caregiver?
Actually, just now Dr. Chong asked me how's Mama. And I wasn't able to say anything, right? Well, my mother has got 3 strokes. She's got Parkinson's. So that makes her very immobile, unable to talk, unable to do all your 6, 8, activities of daily living. Yeah, so it is very tough.
I mean, you were so vulnerable in the book, right? You were writing all these,
frankly speaking, it was so hard for me to write it in the beginning. I was writing it and crying, But then after that, you write, then you got to reread, right? Edit, right? Do changes, right? Then it became like some CN boy. You just got to use your own thing. So sometimes when people tell me it resonates, I feel a bit surprised because I sort of forgot what it was like when I was writing.
I think a lot of people would then want to know that today, if I'm a new caregiver, right, I just something happened. Tell us some best in class ideas, like from your point, because Bertha wrote it from her first personal experience, right? But from your experience, for a new caregiver, how does one maneuver this space?
One is to ask for help. Don't think like you're the only person in this world having to look after mom or dad or your child. I just want to add that caregivers can be caregivers of a very sick child. So I kind of am trained in looking after dying children, a specialty in palliative care that I went for further training. And a lot of the caregivers I look after are actually parents of children who are dying or children who are not dying without a fixed expiry date, but really vulnerable and fragile, and then it's a like 24/7 kind of work. So those are the types of caregivers I know. But coming back to what I was going to propose, ask for help. So don't think that you can solve it all by yourselves. Don't think that you can wrap it all up at home and nobody discovers that you've got a fragile vase at home that needs tender, loving care. So that's the first thing you must do. Second thing is not be too harsh on yourselves. A lot of us are perfectionists within ourselves and we want to do a very good job. But nothing in life is perfect. Obviously, somebody's sick, whether it's a fall, a stroke, or a cancer. It's not a perfect situation, and therefore there will never be a perfect solution. So remind yourself again and again, you are the best caregiver if you're already there. Because I have seen so many, sisters, brothers, relatives like kind of disappear all of a sudden when something happens. The fact that you're there, you're already a very good caregiver. But I want to emphasize again, don't be too harsh on yourself. It can never be perfect. It is just the best for the situation, the best for your family, the best that you can do at that point in time, because your energy levels may be this much or this much at different times. So don't torture yourself, don't punish yourself. Be kind, which also means to take breaks and go away. You don't have to feel guilty nor regretful. Even if something happens, like if you take a break and then suddenly your mate calls you and say, "Oh, mom's in danger," blah blah blah, and then suddenly your heart will sink, and then you will like blame yourself for life. Why did I even bother going to see my hairdresser? But that's the most important thing. I mean, just to mention, have you all ever seen a caregiver that's glamorous?
I hope I look glamorous enough. Hello. Basically, you need to be kind to yourself.
Yeah.
But you also need to be thick-skinned because people will say things, even if it's very well-meaning. They'll give suggestions and, I have like given up. People telling me, do you do this? Did you try that? But, so sometimes you just have to just say, okay, yeah, all right. Yeah, I hear you. Yes, we will do this. And you have to take some of the way other people, the healthy, look at you. Sometimes I view my mother, in the heartland. And the way people treat us, it's like the plague, sometimes, and you do hear people, because you block way, right? Can't enter, right? Bus driver got to pull down thing, right? You got to wait to come down or go up, right? So, so little things like that sometimes can be very grating. And then so your skin must be so thick, just carry on.
Continue to be glamorous. Yeah. Because I think what we need to do, bling some more.
Manicure.
Yeah, hopefully not just for the evening. She does it all the time, right? Yeah, you visit.
No, my mother does. Now, I do her manicure. When people say you look nice, they will feel good too. They'll feel nice too. So it's not just a question of looking after yourself, but making sure the patient knows that the patient is also being looked after in all these areas. Superficial, but important.
It means a lot to them,
Yes,
especially
means a lot.
after they have lost so much. Things that are outside of his control. I think what we need to give back is that sense of perhaps dignity and perhaps autonomy or the one to do something, and nothing is too trivial. So I think after having worked in the industry for more than 20 years, what I realize is the little things count. Actually little gestures, just a bit of a, like touch. And which reminds me one thing. One thing that every one of us can do, not only just not to kind of look at them strangely, is to affirm.
Just lean forward.
Yes,
That's all.
yeah. Either that or go up to them, wow, Well done, good job, and your mom looks so good today. Yeah, I think it's a very small gesture, but it means a lot to caregivers because they live with a lot of self-doubt that they are not doing things right or good enough, or they are just, wrong. But I think little words of encouragement from a friend, somebody who really mean it. And I like to think the other party can receive it. If she wants to say some more, she will talk. If she's not, it's also fine. Because otherwise, she'll be thinking, "Ayo,
What do I say? What
yeah, and then just move away. And you realize, or you don't realize rather, you've made her day. She walks with a bigger spring in her step, and then, today she's even gonna do nicer nails for her mom because she feels good about herself as a caregiver for the very first time, maybe if she hasn't had, anybody given her the affirmation.
Maybe Dr. Chong, because you've seen like a lot more.
Yeah. So
Is this a unique case? Or?
I wouldn't say I resonate with you in the sense that every one of us have our own unique
Ways of
experience,
coping, right?
with our loved ones. So in this case was Mama. And for me, I'm also a caregiver right now. I'm caring for Mama and Papa. Perhaps maybe not at that level of care that you described in the book. But I just wanted to sort of perhaps maybe move away from myself for now, but just say that from my observations working in this line, my line is about looking after people who are dying. So all of them have got an expiry date. So it's so much easier to kind of see the light at the end of the tunnel. You know that you're going to be a caregiver for this amount of time, right? So, but for you, you're not quite sure when this journey will take you or where it will take you and when it will end.
I don't want. Okay, I'm sorry to tell you.
Yeah, tell me.
I don't want to talk about it.
I'm not asking you to
No,
say.
I'm not.
Yeah.
I don't want to think about it.
Really?
Yes.
Okay.
You know,
I will help you change your mind
Oh
by
my
tonight.
gosh.
I think a lot of conversations around caregiving is about ensuring that we've got enough money, we are prepared for it, financially, getting all the insurance sorted. But actually, I think your journey described in the book really describes so well the whole emotional roller coaster, the whole way your life changes, got turned around, and how you needed to kind of pivot from one thing to another and all that. So there's a lot of uncertainty, there's a lot of unpredictability, and also, I suppose what I sense a lot in the first few chapters was helplessness.
Oh yeah. True.
So this is a same kind of theme I see in a lot of the caregivers, whether those with expiry dates or those without definite expiry dates. Because increasingly in the hospice, we are seeing a lot of patients with dementia and non-cancer illness. So these are the ones where it's a bit harder to tell, your mom's got 1 year or your mom's got, and for those, I think the caregivers have a slightly different need from us. They don't want, like you, don't want to talk about dying because that's the last thing they want mom, to go through. It's about how do I live past the day? How to get her out of hospital? How do I even kind of get on with my life with all of these things, like many balls you have to juggle in the air. I think these are the real lived experience of a lot of caregivers increasingally these days. I'm not even talking about sandwich. So for me, I feel like I'm toasted. so I'm definitely not a millennial. I'm obviously Gen X here. So I'm like toast top and toast bottom, literally. And it was a difficult journey even for me as a clinician, knowing how to navigate the health system, but I struggled to look after my parents. And there obviously were times when I kind of regretted some of the things I did, and those were painful lessons for me.
You know what you said just now about help, no? Don't be afraid to ask for help. No, I'm a very proud person. I also think I can do everything. I mean, but I was very well prepared for my mom, that I would have to take care of mom. When you are younger, so you think you can find everything online. You watch a few YouTube videos and you feel educated. But that's not good enough, because a lot of things are the little things that you cannot get there. And sometimes it's very tailored to your own needs rather than something very general. There's so many things I found out. If you do not know health policy, you probably don't know what you are entitled to, what you should get, deserve, because we can't be bothered, that's one. Two, It's too difficult to understand. Dr. Chong was telling me the book, do you update? I say, I update the online version. I can't update the book, right? But because your premiums and your percentages and your needs that keeps changing, So, usually when these things happen, I try and tell people quickly, the news, no. The news is, hey, hello, if your household income is within here, you can now get this, no. So these kind of things, you won't know. I don't know. My mother didn't get her pioneer disability assurance for what? 2 years. It's supposed to be automatic, by the way. Guess what? I only found out when she went to hospital again. And then the AIC people told me, oh, something wrong. Okay. And then when I was doing the book, even better. Because, of course, I asked for details for my mother's case, right? Then took so long to get back to me. And that's because they owe me money some more. So the home caregiving grant, they only dated it from this time and they should have dated it from God knows when. So then they came back. Wow. So you see, there are a lot of things that you don't know. I mean, maybe you're well off and don't think that, but I tell you, every little bit helps. I mean, it was very nice of them to not make noise. I put it all in. Because I think it is responsible, the responsibility on our part too, to also do some checking, and we don't. I don't know how many of you noticed in July, there was this whole medical subsidy thing. Some people got more, some people got less. They had to correct it. And those people who got paid more subsidies, they keep up. But then the thing is that if it's not for the people inside being honest about it, you also don't know, ma. It was because one person went and tried to do the math that they found out.
I think this is the continuum, right? Where there is a expansion of social policies, especially with care, caregiving, home care. This whole bit is a growing space, right? I would say, right? We're, at least as a society, it does look like we're expanding down this path, right? So a lot of national schemes are essentially becoming more and more substantive, right?
Certainly, and like Bertha says, but it's changing all the time.
Yeah.
Right? Even for doctors, I struggle to keep up with a lot of these.
Yeah.
Thank goodness I work in a team, and I've got social workers that I can. Do you know what changed in July? What came on this year and stuff like that. So it would be great if there was a portal that people can go to get the updates. If there was a network of caregivers that can you imagine a Telegram network of caregivers, right? Where somebody, discovered something, just put it out there, and then thousands of caregivers out there can. I mean, if you want to see, you see. Don't want to see, it's okay. It's just white noise in the background. But I think it is so important to keep everybody kind of updated because I can sense you kind of went all over the place and finally went to the AIC, see a person face to face in order to get everything sorted out because the whole website is full of information, but to be fair to the government,
you need to see.
There are lots of goodies in there. This I am grateful, having trained overseas and worked in different health systems. I think we have a very robust health system, and in recent years, like Reggie said, there are lots of bonuses, grants, and all that are given.
What is your point of view?
My parents are still young, so fortunately I'm not in a caregiving role. But I remembered about 4 or 5 years ago, my grandmother had a stroke, right? And you could see my parents and their siblings just scrambling, trying to buy a hospital bed, try to renovate the bathroom to put the rails inside the bathroom, try to work out a schedule who would take care of her and everything. And I really wish that all of them could hear the conversation that you guys just had, to know that it's very normal, right? Because you could see a lot of frustration between my parents to take their leave. They were still working back then. They're not working anymore. They're retired now. You could really sense the frustration, right? And I think they really took it quite hard on themselves, right? At least in the first few years. One of the things that I also learned, right, is that when somebody has a stroke, and my grandmother back then was, I think, 88 years old. So my parents thought maybe she had 6 months to live, right, or 7 months to live, and they planned their whole schedule about 6 or 7 months, just to tide this thing over. She just passed last year, so she ended up living another 4 years, right? And so the cost, the mindset, and also the time taken off work plays a huge part, right, in the planning.
If you just scroll any gerontology study, you will see that average consumption comes down at about 48, for your normal consumption. But at the back, there's an exponential ramp up for medical consumption. So this is the first principles of all planning, because that's the structure of how people consume.
I think everybody knows that the earlier you buy insurance, the cheaper it is. I think a lot of people don't realize that or don't actively do something about it, even though they know it. I'll tell my story now. 5 months ago, I was cycling, and basically I got hit. I was cycling at about 37 kilometers an hour. Okay, it's quite fast. I know driving is quite slow, but on a bike it's quite fast. I fell. Luckily, I was wearing a helmet, so I broke 5 ribs on my left side and my collarbone. At that point in time, obviously went to the hospital and everything. For the longest time, I was contemplating whether I should, do the surgery at a public hospital, which will be a lot cheaper, or go to a private. Right back then, I had a referral to an orthopedic surgeon that apparently fixed the collarbone for a lot of cyclists, right? And so I said, "Oh, okay, fine, I want to go there." Obviously, the operation would be, I think, 5 times the cost in a private hospital versus a public hospital. So my entire medical cost was about 40,000, okay, which is a lot of money. Yeah, it's a lot of money, right? But luckily, my insurance paid, I think, close to 95-97% of it, right? My company covered not 100%, right? For company insurance, and then I had my own private medical insurance to make up the rest, right? To be fair, if I went to a public hospital, it will be 100% covered by the company. And then I was on 6 weeks of hospitalization leave or so.
On that continuum, right, there's a lot of numbers floating out there about medical inflation, right? So I think on average it's going at your premiums are going up at 18%, and medical cost is also exponentially growing, right? To a point where our health minister had to come and do videos, right? So that's the kind of intensity of the talk of the town, right? It's intense. So then, from a planning standpoint, is there a way around this? Can I, should I invest my portfolio? Because the numbers don't add up. I can't run an investment structure to outpace the inflation in the medical space. You know what I mean? Yeah. So is that a hopeless cause? Is it just a continuous stacking of insurance premiums?
Yeah, as you rightly pointed out, right? I think medical cost has increased. Okay, obviously more than general inflation. This is something that to a certain extent cannot be helped, right? With the super aging population in Singapore, the reality is that a lot of insurers are also getting more claims, and that's why the premiums and the cost of insurance has also gone up to a certain extent. But I think that ultimately it's important to just get a policy that you can afford and that covers you mainly for critical illness and also hospitalization. I think that's very important, because if anything happens, then you might not have enough for your kids, or to also cover your parents if you're in the sandwich generation. So insurance is always very important, and it's something that I'm a very strong advocate for, right? And obviously making use also of CPF top-ups, SRS and that stuff to basically just try to maximize or optimize your taxes. I think a lot of people don't optimize their taxes by topping up their SRS or CPF for their loved ones or for themselves, right? And obviously, I think a lot of people know about it, but it's about taking action.
On that note, it's free money. The government give you free money to top up your CPF so that you move down the tax bracket and then still get the additional top up, right? So you should try to capture that lah.
No, I think basically what we're talking really now about trying little gaps here and there. Yes. When maybe you should just relook the whole structure of healthcare, medical costs. When MediShield came up, it was an insurance thing. And then they added the IP. And I remember at that point in time, a lot of people were asking, but the insurer, if they raise the premium, then how? Because then, I remember the answer from the government, that is between the insurer and the client. We are so much at the mercy of the way, whatever internal structures and other people, we don't know, we can't tell, it's too complicated. and there's no big civic group that is really looking after our interests. I mean, you go to other Western countries, there are big groups which take care of the consumers on certain fronts, right? You know, whether on this part. So they are the more expert parts. But we don't. You know, like at least the retail investors, they got SIA. So different groups have got different experts who will lobby on the client's behalf. So now what I'm hearing all the time is, government got this, you better take, which of course I also agree. But you know, the healthcare system has got two means tests. And by the way, if you want to extend it, in education, in social, also got means tests. First, there's the national means testing. And then after that is the household means testing. The household means testing is different for health and different for education. It can be household income, gross, or it can household income per capita. You know, so basically, we are in this whole big matrix of numbers, crisscross, that if you want this thing, you have to see which one you, then I'm here. Then this other one, then I'm here. So basically, we are caught in this bind where we want to achieve too many things. We want self-reliance, we want government take care of us, we want private sector involved, and then we want to assure healthcare for all. We don't know what is affordable healthcare. We don't want insurance to make money too much. So there's so many competing needs.
I mean, if you go deeper and understand, the logic behind, there is always health economics is about a limited resource and serving the most people for good, yet not breaking the bank because the resource is always limited. So I've always thought, working in healthcare for more than 40 years now, that I don't want to be the health minister because it's a thankless job. You cannot please everybody. We could never know all of these policies, like front to back, back to front, and But what I was trying to say is that if you don't know, it's okay for now. Begin to get literate, begin to listen in to some of the conversations that exist. And like when people mention it, at least I've heard of it. And then if you want to look for it, you can then, either Mr. Google or walk into the AIC office and speak to a real person, hopefully not a chatbot.
Yeah.
And then discover a little bit more. Because I think as like every human, until, the 14th of April, you would not think about paying tax. Until somebody is sick or dying, you wouldn't check out, Singapore, how many hospices are, things like that. We cannot know everything in this world. So know where to look for help. And then help is always available. So I think it is also a call to action for more people who are experienced, who have had those, lessons learned to share the message. There are lots of signposts in Singapore. Singapore Hospice Council, for one. If you have anybody who has a serious illness, you don't know where to start, what to do, just contact them. Yeah. So they will, reply, respond in less than a day.
But I'm saying that, yes, we all literate people already have difficulty, much less other people. But I'm also suggesting that the literate people also look at the basis of the health economics that we practice so that everybody will have an easier time. So, I understand all this thing about scarce resources being shared, but then you also may want to think about what is the degree of private sector involvement? What is the extent of most of us are covered? What is most? Like even now, they can't decide annual value of the house. They have to three-tier the thing. Maybe we do need something not so shifting in the sand. That basically, if this happens, that's it. For example, CPI. What do you peg to this? So, Medisave premiums or whatever, when do we expect it to rise? So, there must be some expectations there, you see.
To be honest, the population is growing older, so quickly. We are looking after so many people, at that level of the pyramid, with very few people working up there. And I think we are planning like 10 years ahead, right? So I'm not speaking for any party, any government in particular, but as I've said, with a vantage point from the inside, I can totally see how, expensive things can be.
Yes.
We offer hospice services at home to our patients and families for free because of everybody who had donated. to allow our services to be run for free. And I think people still don't know. And many people who visit us from overseas are very surprised that we can bring a doctor, a nurse. I do home visits. I visit them, once a week, once in 2 weeks and all that. They don't have to pay a cent, right? A specialist consultant visiting them, helping to make very difficult decisions. So these are information that you might not know, but that if you're in trouble, go and find out. And then you will discover all the unknown sort of fortunes, riches, and treasures that are hidden, perhaps maybe because our lives have been very blessed. But all of us will be in that position. If not ourselves, our loved ones and all that,
Actually, I think the
whether
bigger-
it's sickness or a terminal illness.
I think, but the bigger problem, I don't know how we're going to cope with this, is our living arrangements going on, Because, community care apartments, you can only build so many, This is a small country, So in terms of living arrangements for people, the Gen Xers and millennials coming, got fewer and fewer children, no children, right? Where are you going to put yourself? You want to go and downgrade, get, lease buyback, whatever, okay, all that. But still, you will need help. People need to look after you, So I think a lot more thought there.
And I think that's a big bit as to why people want to kind of move up the insurance ladder. You know what I mean? Like when they start taking that private, structures and they go into that bit, right? The whole idea is not just about managing costs, it's about removing this whole bandwidth. Like, I don't need to think about it. Yeah, I just maximum, I just price this whole thing out and then I just make sure the numbers make sense.
Then again, these things don't last. When you talk about ins and outs equations and equity to the whole country. So I can totally understand how people worry about the money, but I like to think it is not just about the money.
I just want to bring it back, right, on this front. Maybe give Tim the last word, right, on the part on the whole, the money aspect, right? Because they already tell you all their life experience, right? Everything. They're making this a tough job, right? So given all these contexts where there's an expanded, social safety net, and there are more and more, options out there, other than like, buy early. Everybody's already doing that and everybody knows that, right? Like in that context, how would you kind of share some thoughts for us? We contextualize it to the working professionals, yeah? So people in the 30s, 40s, all your millennials, not just caring for ourselves, caring for our loved ones. How would you kind of work this through?
How I look at this, right, is that you need to plan properly, and it's always it's a very motherhood statement when you're talking about planning. It's not just about looking at your income and your expenses, and obviously there's a lot of hidden expenses when you talk about caregiving, right? Like I mentioned, the renovation in the bathroom, the beds, all that stuff. You need to have 2 maids over here. So it's just looking at the entire budget, all your expenses, and also planning about how long it would take that you need to basically spend this money. Obviously, for some people, there would not be trade-offs. For people, they can spend as it is good for you if you fall in that bracket. There are many of us that have to make trade-offs, look at needs and wants, right? And obviously, it's always very easier said than done. I remember about 10 years ago, I was a lot younger, right? And then after that, I have a good friend who called me up and said, can you lend me $2,000? My father just went to hospital. And of course, I said, okay, fine, right? Your dad just went to hospital. And then 2 weeks later, he was posting on his IG being at the Four Seasons in Langkawi, right? That's a prime example of, even I've never been to the Four Seasons in Langkawi, okay? But essentially, that's a prime example of not planning your budget properly, right? At the end of the day, not having emergency savings, and also not investing at the end of the day. I think investing at least 10% of your take-home pay is just so important to break the cycle, ensure that your kids basically will not be in this sandwich generation anymore, and also to ensure that you can take care of yourself, right? Because I think a lot of people or just human nature, right? You want to take care of your parents who have taken care of you. You want to take care of your children and always give them the best. And then I think a lot of the time we forget about taking care of ourselves, right? And I think that we all need to also take care of ourselves to ensure that the next generation doesn't need to financially take care of us, but maybe taking care of us in other ways.
If we assume that medical inflation is, in the teens, right? In today's number, you're the head of investment, huh? Okay,
Not head of insurance.
Yeah, exactly. You're the head of investment. So if we assume that medical inflation is going to go at the teens, and the word on the street is, broadly diversified investments, you get anywhere from 8 to 10%, right? And you never even consider FX yet, right? So because that we're doing in the US. So is it a very fair statement to say that it's not easy for your investments to outrun the medical inflation?
In the long run, it could. Obviously, if I had a crystal ball, I would be able to predict better, but that's obviously the $1,000,000 question. But I think in the long run, potentially medical costs will stabilize one day. I mean, it cannot grow at 18 or 20% a year, right? Then it basically becomes impossible, right, to afford. So I think in the long run, these things tend to work themselves out. Obviously, like I said, and Reggie also said, diversification is very important. Just because the S&P 500 is run up a lot this year, don't put all your money there, right? And essentially have a diversified portfolio that would definitely perform better in the long run.
Fair. Thank you. Can we give the panel a round of applause? Awesome. So now I know we spent quite a bit of time talking. I do want to spend the remaining time and whatever I have with all of you to take your questions. So anybody has specific questions targeting any specific panelist?
It is something that is often sort of misconceived. People think that signing that just meant you're signing your life away. But what that just means is that the day you become a vegetable and are depending on machines to keep yourself alive, and you have an AMD sign, I can turn off the switch without having to ask anybody. Only when you are a vegetable and you are surviving only on a machine, I can switch it off. So, but it's better than nothing. So it took a long time for this government to sort of engage the public and then got lots of referendum and all that to get this kind of law signed. So, and it's very easy to do. Just walk into a GP clinic, we can sign it and then just send it off. And after some time, you will get a letter coming back to you to say, yeah, you've got it, we have lodged it. So, except that when or even when anyone who has had an AMD sign, when you go to a hospital, don't tell people that you have an AMD first because the doctor cannot ask. The doctor mustn't know. I think people are worried that if you have an AMD, okay, this one passive, this one no need to do. Just try a little bit, don't try too hard. No, it's not like that. So an AMD, I say again, only kicks in when you are a vegetable, totally dependent on machines that it actually works. Don't go to the hospital and say, I have an AMD. You will still be sent to an ICU. Everything will be done until you become a vegetable. I'm so sorry that I call people vegetables, but I suppose this is the most easy way for people to understand. When you totally don't have control of yourself, you are totally dependent on a machine to stay alive, to have a heartbeat. None of us, I'm very sure none of us want to continue to stay alive. Therefore, everybody go and do your AMD.
For my generation and the one below or whatever, at the end of the day, how are we going to take care of ourselves? Where are we going to live? I already said community care apartments not good enough. All the private sector type of retirement village kind of thing, or they can't afford this, can't afford that. Now you want to age in place, right? I mean, okay, they're doing something in terms of the active aging centers and all that, which I totally say wonderful. But we need to really pull all that together. The better people are your active aging center people who should go out of their center and, into and knock doors.
They do.
Some. I know which ones do, which ones don't.
Okay.
But basically, that's the way to bring the community together.
I'll say that we have a whole spectrum of different facilities, coming back to the ones that commoners like ourselves can afford. So there are also paying ones and there are subsidized ones. The subsidized ones, again, that the government funds a lot, need a bit of a wait. So, but the
Yes,
government
long
is so
queues.
good that they will actually pay the private nursing homes to lodge you there for a while
Wow.
if this is urgent.
Transition,
Yeah. And until a home in the government ones becomes available. And I've walked into and seen patients in those nursing homes. They are decent. We do have, ways to audit them, ensure that, I mean, once in a while you do hear of certain things happening, but they happen in expensive places too. Because again, does anybody want to work in a nursing home, as a lifelong career? I mean, who are the people working there? So again, I think it's governance, it's about leadership, and it's about a vision. So I think that's the reason why there are some Singaporeans who have come out to, I want to open my nursing home. Unfortunately, they also realize it's not so easy to run, and that's why it's so expensive. But again, what they're offering is an option, a choice for somebody who can afford.
Can we give the panelists a round of applause? Thank you, thank you, thank you. Thank you.